All right. I'm with Jane Gregory. Hi, Jane.
Hi, how are you?
I'm doing so well. How are you doing?
Good, I'm great.
Thanks for joining me for an episode for the podcast. So glad to have you here.
Oh, I'm so honored and excited to do it and really excited.
Aw, well, before we get into kind of all about acupuncture, I want to ask you this question. And it's something I read on your website that you consider your own fertility journey one of the most valuable experiences of your life. And it's enriched both you as a mother and as a human being. Can you share a
Mhm.
little bit about what that means to you, your own
Yeah,
fertility journey?
yeah, it's ironic because I started specializing in fertility soon after I moved to Denver in 2003. I met my mentor, Randine Lewis, right after her book, The Infertility Cure, came out. She
Mm,
came here and taught a class, and so I was introduced to her then, and that was, I think it was late. It was early. It might have been early 2004, late 2003, but I moved here in 2003 and set up my
okay.
practice. And so I started specializing then in fertility, and I was one of her first mentors to go on her fertility retreats in 2005. And actually, I started trying to conceive right before that, and I was pregnant at that first fertility retreat, which was really weird because it was these all these women that have been struggling for a long time with their own fertility. And I felt actually guilty
Mm,
about it. I was like, oh, I got pregnant on the first try and all of this stuff. So that was emotional. And then I ended up having a loss around at 12 weeks, a little bit after maybe 12 weeks. But, and it was
mm.
pretty traumatic. It was very traumatic
Oh,
for me. And so
mm,
after that, then I had some stuff going on and I think I had tried again. That was like in January of 2006.
hmm.
Sure. And then I went through some time where I just had some like other like inflammatory stuff going on where it was like hard to even try to conceive after
Mm.
that loss. And then I think I got pregnant again in the summer, but I miscarried really early at like 6 weeks. But I had PTSD from the first miscarriage because I started spotting, I think I was like at the financial planner who was actually my client and her dad, and she was pregnant with twins from
Oh,
so crazy.
oh,
Um, and then that time, the second one, I was like supposed to work that day. And I actually like went to work while miscarrying. And I was so dysfunctional about like overworking at that time in my life that somebody showed up and I was like, well, she's here. I was trying to cancel the patients and I
mm,
just like worked through it. It was awful. It was horrid.
oh,
Um, and that also happened to be like the same week that second miscarriage which was early, and I just passed everything. Um,
mm. Oh
Naturally, both times. The first time I went to the hospital, it was like horrendous.
my
My
gosh.
Yeah, that same week, my nanny from growing up, who kind of raised me, also died, and I was just it was a horrible time.
Mm,
Um, so I then went through a time when I just like was like, I'm not going to try. I'm just going to do this yoga teacher training because I started this fertile ground yoga class back in I had started it before I even did the teacher training. I think that was in 2005-ish when I started teaching
mm-hmm,
the yoga to my
mm-hmm.
patients. And so I took a break, and then I really wasn't getting pregnant at some point when I tried again. And I had been working in the field, right, already for a couple or so years by the time I was going through that myself.
Okay.
And yeah, so it was hard. It was really hard
You were
because
working in the field, helping others in the fertility space
yeah,
as you
yeah, and like
were.
going through the losses, and
Wow.
then I wasn't getting pregnant. And I was like, really reticent to go through fertility treatments, nor did I have the money at the time to probably go through
Hmm.
fertility treatments.
You really understand, I mean, personally,
Yeah, it was really
this this journey.
very painful experience during that time. Yeah.
It's just given you, I think, such a deeper understanding, like
Mhm.
for this kind of work and the compassion you probably bring your clients. I mean, having walked through loss, pregnancy loss, like you get it.
Yeah, it's hard. And it used to be really hard. It would, to go through pregnancy losses with people, but I've been doing it for 20
Mhm.
something years or whatever now. So it's easier and I'm in a different place in my life. But yeah, it would be hard for me just because I was had so much empathy that I would sometimes like get overwhelmed by it.
Mhm.
It's hard not to get a little overwhelmed by the loss sometimes. But I also think, yeah, I think I have a totally different perspective because of that experience. And then
Mhm.
decided, I had a client actually who was adopting. I had a couple of clients who did adoption, and I would always kind of get so excited to talk to them
Mhm.
about it. And one was doing China, I feel like, and then one was she just had really severe endometriosis, and she didn't even go through any fertility treatments, and she adopted from Ethiopia. So that's how I even started thinking about Ethiopia. So by the time I started moving towards that, it was about 2007, I think, when we started the process. So
Yeah, I just learned that about you. I did not know you went through adoption.
yeah. And so we started the first adoption process, I think, in 2007, and my son came home in 2008. And then we
Wow.
started the second adoption in like 2009. We had to wait till our son was one, our first son, to start the other one. And he didn't come until January of 2013. So that took
Okay.
forever, which
Oh
was,
my gosh.
yes, yeah.
That's probably a whole nother talk we could
That's
do.
like another
Adoption.
long
That's
story. It's
another
like one of the
topic.
worst things. It's
Oh
like
my gosh.
I think about that a lot with my clients, because some people, it's like a whole nother thing to go through. Like if you've already gone through a bunch of fertility stuff, then to go through like the emotional turmoil of adoption,
Mm. Yeah.
um, is really hard to go through both.
Were you going through fertility treatments?
No, I did not, because
Okay.
I started to no, because
Okay.
I was like terrified at the time, to be
Mhm.
perfectly honest. I was terrified at the time to like find out about like my labs. I was like, what if they're bad? And I just couldn't even handle it. So I didn't do
Mhm.
it. And then I did do an HSG because I wanted to make sure, I was like, well, maybe I'll never get pregnant again, and that might be fine, but I don't want to have a miscarriage that's preventable. So I did things like clotting disorder labs and, or some recurrent miscarriage stuff.
Mm.
And also I did an HSG just to check for like a septum. But
Mhm.
then when I did the HSG, one of my tubes seemed like it was blocked. And then I was like, oh my God, I am infertile,
No.
and then I just sort of I really kind of tuned into my own intuition about like what felt right for me. And had an epiphany that, well, at the time, international adoption was an option that was much easier than any adoption probably is now. And
Mhm.
also I really just didn't want to go through the medical part. Like I was freaked.
Yeah.
I don't even like having my blood drawn. So, you know what I mean? That was
Yeah.
like, I was like, I don't know if I could handle that. And so when I was doing that stuff too, I mean, the IVF was not like the CCS testing wasn't even happening. They had like fish testing, they had day 3 embryo, they had much more inferior,
Yeah.
like, embryo testing.
It's
Like it
been
wasn't
renamed so
like,
many things, right? CCS to PGTA.
yeah. It's just so different now. Like
Yeah.
I don't think it was as, it was totally different then. And the
Mhm.
technology wasn't as good. And I didn't have like $20,000 that in case it didn't work, extra
Yeah.
to spend on it. Yeah.
I know you helped so many going through fertility treatments, and you're the founder of Acupuncture Denver. I want to hear kind of like how that all started. Like, were you always interested in, like, I know there's so many different aspects of acupuncture, and fertility is just one focus. But
Right.
tell us about what are some of the different specialties that you do as an
I mean,
acupuncturist?
really, we just highly specialize in fertility and women's health.
Okay.
So, there is this trend among acupuncturists for many years now to like say they specialize in fertility, or it's like
Oh, geez.
listed on their website as like one of their specialties, when in fact they really aren't trained
Um,
probably as specialists, because anyone can put that on their website. So like I said, when I moved to Denver in 2003 and started my practice here, I had a really good friend in Seattle who was specializing in fertility. She was a classmate of mine.
mhm.
She owns a few clinics in Seattle now. And then she was working in that field. And then I met Randine, and that was where I got really inspired. I was just like, oh my God, I want to do what she's doing. And I was inspired by the intellectual side of women's health and fertility, and just being able to specialize, because Chinese medicine is so vast. And, especially in Chinese herbology, Chinese herbal medicine, it's really intricate, to practice Chinese herbs in a nuanced way. And, like I, for instance, can write a lot of fertility formulas out of my head, or, create a custom formula out of my head in fertility or women's health stuff. But like, if somebody's like, I have pneumonia, it would be hard for me to be as expert in such general things.
When you say write a fertility formula, you're talking within herbs?
Yeah, like Chinese, traditional Chinese herbs, which are, a polypharmacy. So there's always, 4 to 25 ingredients in a formula. And, like we have so it's really sophisticated. Again, like there's acupuncturists who didn't even study herbs, who like give people herbs, because there's nobody necessarily regulating that either.
That's scary.
Yeah, in order to be expert in it, it's such a vast, it's like, you can't be good at everything, right? Like I don't treat kids, because I feel like that's so specialized. And
which one is, I'm sorry?
Children. Like I don't know
kids.
or babies.
Okay. Yeah.
Because I'm like, that's very specialized. And so I did a ton of extra training after I went to school, with Randine, and then, any kind of like early, sort of in the early 2000s, the sort of pioneers of like fertility acupuncture, although it's been practiced forever, right? In traditional Chinese medicine. But Jane Littleton, I studied with her when she came to Canada one time, and she sort of wrote the textbook on Chinese medicine for infertility. She studied in China. She's in Australia.
Oh, wow.
Yeah. So I just did as much training as I could get in the early years of specializing.
I think some of those certifications, like I learned about the ABORM certification, which is if you're a board certified fellow of the American Board of Oriental Reproductive Medicine, like that is important that someone has that, right? That
and they just renamed it, FYI, because of.
Oh, now what is it called?
And now it's American Board of, oh my God, of Chinese, of like traditional Asian medicine, maybe, or Asian medicine. It's awful that I don't know, but it's still the ABORM.
And there's that one. And then you have another one, the NCCAOM.
Yeah, that's just the national certification. That's your national certification in Chinese, in acupuncture or herbology or Oriental medicine. So that's like your national board certification.
Okay.
Acupuncture.
Okay, gotcha.
But the ABORM was started, I think the first year was 2008. I was in the first cohort of people who got certified. So it involves being sitting for an exam about reproductive medicine in women's health and Chinese medicine. And then every year we have to maintain, a certain amount of continuing education credits. So it is important because, like I said, there's so many acupuncturists who just like say they're fertility experts. And what I always said from the beginning, to people like patients, or on our website, we have some information about it, is that, like for a lot of women, they don't have a lot of time to mess around. Right. And, and if you don't know what you're doing and you're just giving bad advice, either about like what sort of Western medical treatments they might, about that, like, you should be able to know what their labs mean right off the bat. You should see a red flag, like, okay, you had chlamydia, you have risk of, tubal, like blocked tubes because of water. If you've had untreated, if you have endometriosis, maybe that too, that you should definitely get an HSG, or, know what kind of testing the patient should get, because they might not have time. I've seen people who've gone to acupuncturists who told them they could unblock their tubes. It's just not possible. We cannot unblock scarred fallopian tubes. Acupuncture or herbs. I don't care like what you're doing. It's like physical scar tissue and all that. So, or adhesions, it's not possible. So you could waste a lot of money and time seeking care from somebody who doesn't really know what they're doing.
What would you say if you could just give like a basic 101 for acupuncture and how that can support men and women, correct?
We see mostly women because it goes to anything. like, you know, how men are with health, but we see men with sperm issues. It can especially help with motility, even in the short term. Acupuncture, I think it infects meta-enkephalins in the sperm and the semen
Hmm.
that can like help with motility, even just like right around ovulation. And
Hmm.
we see people, you know, we've seen people with like a minor varicocele, and
Okay.
you know, they can use herbs and acupuncture. A lot of people with like count issues. And of course, we cannot help people. Like the things that are not going to be treated with Chinese medicine or acupuncture are blocked fallopian tubes and azoospermia, like no sperm.
Mm-hmm.
We
Mm-hmm.
can't really fix that. I
Can't
mean,
create
like
more.
oligospermia, yes, like we might help with that. So I mean, the main thing, I think the main reason that acupuncture, like outside of herb, let's just say acupuncture for now, helps with fertility both in men and women is because it really improves the blood flow to the reproductive organs. And I think it's doing that because it strongly downregulates the sympathetic nervous system. So it gets people out of fight or flight.
Yeah.
And so we see a lot more blood flow and hormonal optimization. And that's, I think, the main reason it's so effective for some people, is this central nervous system effects that it has.
Mm-hmm.
Yeah.
And like stimulating ovulation in women.
Yeah. Yeah. We do a lot of e-stim, which is important for that. Again, like, yeah, like e-stim is extremely important. Elizabeth Stenner-Victorn is a researcher in Sweden who she's done a lot of research there because it has to be evidence-based, because it's like paid for by the government to get acupuncture, you know, it's socialized medicine.
Mm-hmm.
And so she's done a lot of work with like PCOS and also the blood flow treatment that is effective for improving uterine artery pulsatility, which is like if you have like when they do a Doppler ultrasound before an IVF, not every clinic does, but a lot do, to check for that uterine artery blood flow. It essentially, when it's over 3, it means it's hypertensive, right? So the artery is sort of, you know, hypertension in that artery. And acupuncture corrects that blood flow problem. Like
That's amazing.
like pretty much 100% of the time. And she pioneered that study. I think it was like in 99.
Wow.
And that's why like CCRM started adopting acupuncture a long time ago, you know, recommending patients to get treatment, but you got to get the right treatment, which is this kind of 8 treatments over 4 weeks. And it's the specific protocol with electroacupuncture.
I was going to ask you about that. 8 treatments over 4 weeks. Is that like
Twice a week for 4 weeks is
twice?
the Stenner-Victorn protocol. And that will improve the uterine artery kind of blood flow impedance.
Okay.
And they hypothesized in that study that the reason was this downregulation of the sympathetic nervous system for that.
Is that like a typical protocol too, or do you have a standard protocol when someone comes to see you? Like,
we don't do the same exact treatment, but we do use that Stenner-Victorn protocol a lot during the stimulation phase of IVF for people, also just prior to ovulation for anyone trying naturally. And she also did a lot of research with this similar, you know, it's like high intensity, low frequency electroacupuncture on the abdomen as well to help with like ovulation induction and PCOS. And her research has shown too that like people with PCOS tend to have like upregulated sympathetic nervous system activity going on too. So she's done a lot of research with that, and also with even like exercise and PCOS. But we do a lot of the e-stim because it is really effective. And then my colleague Diane Credenda did some studies with her partner Magarelli, who's, you know, an RE, on like live birth outcomes after using that same protocol, the Stenner-Victorn protocol. I think it was like 8.5 times before retrieval, it showed more positive outcomes for live births.
wow.
So we also try to have people do twice a week for 4 weeks leading up to a retrieval based on that.
Okay. Leading up to a retrieval. One of the questions that was sent in to me was, is there anything at any point in a cycle that an acupuncturist should avoid doing?
Like in an IVF cycle?
I'm knowing this person. Yes. I'm assuming yes, that's what they're referring to.
Stimulation cycle.
Like if you're before transfer, after transfer, maybe.
I mean, I frankly, okay, so before retrieval, we typically stop doing the e-stim like once they trigger, or like the day they're going to trigger, if they're going to trigger that night, just because like in the outside chance it could stimulate ovulation. But I mean, I've only seen that happen, I think like one time ever. And it might've been, there was one time when like Cetrotide or Ganirelix it was like a bad batch or something, and people ovulated through the suppression drugs.
Wow.
So I've never seen people, but just because like we understand how things work, we tend to like stop the e-stim right at trigger point.
Okay.
Right on the trigger. But I'm not positive that that's like essential, right? And then also I like to wait 7 days after a transfer to do acupuncture again, which is almost like at this point just my superstition, and it's other people don't do that. I think I was looking at a study this morning in the Westergaard study, looking at FET acupuncture, it was more effective, but then getting a treatment 2 days later did not help. I don't know. It didn't improve chances. So we just wait 7 days. I don't know. At some point, I remember hearing like in some class that having acupuncture right, 2 or 3 days after had a maybe negative impact. But I mean, most acupuncture is homeostatic. Like, that's why it's safe in pregnancy. Sometimes people are so terrified of acupuncture in pregnancy, and we see pregnant people every single day at our clinic, every trimester.
Okay.
I mean, you're not going to I don't know what people think is going to happen, because you're not going to induce, cramp,
contractions.
At the end of pregnancy, we do try to help get labor going for people, but we do really specific things to do that.
Okay. Back to the transfer real quick. The acupuncturist I saw, and this is before I knew you, but he recommended doing having an acupuncture session the day of transfer, before the transfer, right after the transfer. That there was some study.
Yeah, there is a study. So there's the pre and post transfer acupuncture, which we do on site at Consensus and some other places. However, honestly, that was the Paula study. The initial kind of seminal study for that was in 2002. And that was all day 3 fresh transfers, So it's a different.
And I didn't have a fresh transfer. Mine was a frozen.
Hardly anyone does anymore. Right. So, we do the pre and post on site at some places or sometimes, but I honestly don't think it's essential. So, and then there was a study in Seattle where when people had to travel for acupuncture, it was like worse to do that.
Oh,
so like when people are going, for instance, to a clinic where we can't go on site, we will have them come the morning of the transfer and just pre-transfer acupuncture.
Right.
And I tell them just go home and chill. Like, don't come back here after. It's just too stressful. And the effects of acupuncture last at least 24 hours, like the hormonal effects and all of that. I think the idea with the transfer acupuncture for FETs or transfers in any kind of transfer is like to calm the, uterine contractions and, kind of maybe shift the hormonal milieu a little bit. But it doesn't have to be done in that exact way, like that original study, because no one's getting day 3 fresh transfers. But when we have the opportunity to go on site at some clinics, and we do, and people want that, but if they don't feel like, if they can't get that for some reason, I think getting it either like the night before or the morning of is great.
Okay.
But not like traveling back to get another treatment.
Yeah.
I don't think that matters.
Waiting about 7 days after a transfer is what you suggest.
That's what we do. And I mean, sometimes people just accidentally booked and they come in. We just do very gentle, kind of like holding treatments, calming the mind, not moving a lot, of not really moving points, right? Just kind of moving upwardly lifting points.
Okay. And then after a transfer, say you go back 7 days, or after that, how many times then do you suggest people see you?
I mean, we usually say come at least 7 days after, like wait 7 days, come after, or when you're pregnant or whatever you find out. If you're not, you can also come back, obviously. But we usually treat women in the first trimester weekly or every other week, and then monthly the rest of the pregnancy. And then the last 4 weeks, we try to do weekly to do labor prep.
Weekly, you said, okay, so have a transfer, then weekly?
Weekly or bi-week or like twice a month in the first
Okay.
trimester. But some
Okay.
people just love acupuncture and they want to come
Yeah.
every week and they're really anxious. And so they come
Mhm.
weekly, but even every other week is fine in the first trimester, and then monthly or as needed. Again, some people just like acupuncture and come more.
Yeah.
And then the last 4 weeks, if they're going to have a vaginal birth, to help with labor prep.
And then in the beginning, someone who's looking to conceive, preparing to conceive, ideally, like, is there a time frame that's you suggest people see you?
I mean, for preconception, because of the cycle of folliculogenesis, like how long it takes for an primordial follicle to become an antral follicle, which is like 90 to 150 days,
Mm-hmm.
increasing the blood flow to the ovaries during that period of time is ideal, right? And that's why it's ideal, if possible, for people who are going to do IVF even too, to get acupuncture starting like 90 to 150 days prior to improve the blood flow. That would improve like the cellular health of the eggs as they're going through the folliculogenesis, like especially like 65 days before they become like antral follicles, which are
Mm-hmm.
the follicles that are visible on ultrasound, right? On
Okay.
X-ray.
Okay. Mm-hmm.
But because we have all of our follicles from whatever fetus time.
Yeah.
But as they come out and go through that folliculogenesis process, you want good blood flow, which improves the like things like vascular endothelial growth factor, like the things that affect like what is it called? Oxygenation and everything to the
Mm-hmm.
follicles really affect the cellular health, right? And so having that be optimized 90 to 150 days before even trying to conceive is awesome, is great. I mean, probably some people come in, they're like, I'm going to start trying to conceive, and they might not have an issue and they might get pregnant like the first or second month, right?
Mm-hmm.
But if you're older, and you want to optimize for a healthy pregnancy and
Yeah.
better cellular health, it'd be great to do like 3 months of acupuncture and diet. Everyone kind of talks about that 3-month process of preparation. It's because of the time frame for the folliculogenesis.
Okay. And the frequency again, if you're starting, say 3 months before.
I mean, we usually recommend just like weekly treatments for people,
Okay.
because it's like cost prohibitive, and also, just time. Again, some people are really like, I'll do anything. I'm going to do, everything I can. And they might want to do twice a week.
Oh, and do you find insurance covers a lot of this,
I
or?
mean, we're not in network as a clinic because it's
Mm-hmm.
tricky with fertility diagnosis codes,
Mm-hmm.
and just billing insurance is awful. But so we provide super bills. I think some people have coverage for acupuncture, but another reason we haven't, because we're so specialized, often the diagnosis codes needed to be like pain related to be covered for people.
Oh, okay.
So, it just depends, but a lot of
Okay.
people.
You said a super bill. What's a super bill?
Super bills, like if people pay us, we can provide, it's like a little more detailed than a receipt. It has like diagnosis codes,
Okay.
ICD-9 and CPT, the
Yep. Yep.
treatment codes and all that
Treatment
stuff,
codes. Okay.
and like a
Okay.
bunch of details. Yeah.
Okay. This is really good information. Yeah. When I was first starting, not even in the very beginning of IVF, I mean, I wish someone had told me about it a little bit sooner. It's a good idea to
Mhm.
start some acupuncture. Um, and I just discovered it like kind of as a matter of fact, like a routine, like ultrasound tech person was like, you might want to try acupuncture. And it's like, oh, well, that would have been nice to know about like earlier.
Right, beforehand. Yeah, and I think a lot of times, because we're specialized too, and we've just helped so many women through the
mhm.
process, like they tell us all the time, they're like, you know more than like the nurses at my clinic, or you helped me. Like, we can be like, okay, this is what's going to happen. You're on an estrogen priming protocol. You're going to, this is what it's going to look like.
Yeah.
We've just been through it for millions of times, it feels like. So we can really help guide people. And that's, again, why you want to go to somebody who really
Yeah.
is a
Who knows what they're
specialist,
doing?
because they otherwise might not know. Like,
Yes, you
to
really
help
have
you emotionally.
specific, sorry, protocols, right? At different phases of the IVF cycle. You have
Pretty
different.
much, but also just like having the knowledge that we
Mhm.
have about what happens in an IVF cycle we can give people, I feel like we can give people a lot of like the emotional support they need to get through it. Cause we like can just walk them through it. Exactly like what's going to happen, what to expect and everything
What
like
to
that.
expect.
Mm-hmm.
And so then the herbs are another part of what you do. And does that depend on the individual, and when would you use herbs? When would you not?
I mean, we don't tend to use herbs during medicated cycles that much because
Okay.
it's just like the doctors don't want it happening. And, it's complicated. They're on so many things. We use a lot of supplements, for people preparing for IVF or just trying to get pregnant or in pregnancy, just for optimal. I'm also like really committed to helping people have like optimal pregnancies and healthy babies. And there's so many nutrients that aren't covered by like a simple prenatal that they need to be on. And there's a lot of research now on that and just helping people with that as well. But so Chinese herbs are great because they are so sophisticated and you can customize them if you have a pharmacy like granules or raw herbs, which we do granules, so we can customize the formulas.
Wow.
And we like for things like endometriosis and painful periods, they're really great. And also just fertility in general. And some doctors are like, don't take herbs, no matter what you do, don't take Chinese herbs. There's no research, but there actually is. Like in China, they do a lot of research alongside Western medicine, because it's integrated into the hospital and everything there. And these herbs have been around for thousands of years. Like the formulas are like thousands of years old for fertility, for pregnancy stuff. We don't use a ton of herbs again in pregnancy. It's complicated, but you can,
Is it in a pill form? How is it?
No, it's how we use granules. So they're like they are like an instant tea. They would almost look like instant tea granules, like Nestea.
Okay.
Like they look like that, but they're different colors.
Okay.
So you just dissolve. They've been so the traditional way of making herbs is you would get like the roots and the leaves, and it's all dried and all the parts. And you would soak it and then boil it. It's really a pain. So these have already been decocted. So they were like a soup. Actually, one of the words that's used for like the last word in a formula is like tang in some formulas, and that means like soup. So it's almost like food. When doctors freak out, I'm like, this stuff is like food. It's like really nutritious plants that are like high in antioxidants. Some have been shown to like increase ATP production, and things like that. And they're also really balanced because you're not taking like Western herbology is just like take echinacea, one thing.
Yeah.
You take like a big, mixture of herbs because it balances out the properties of each and you're not getting like one chemical compound in a huge dose. So the side effects are not enough side effects. They are a little bit gross to drink, to be honest. You have to, because they don't taste delicious necessarily.
You touched upon supplements. Can you talk a little bit about that? Is this something, do you usually give people like a whole list? Do you have like top 3 or something?
I think like for anyone just trying to be pregnant naturally, whatever way they're doing it, just being on a good prenatal with methylated folate, fish oil, like a high quality fish oil that's like molecularly distilled, so it doesn't have like mercury and all that, and vitamin D, like 2 to 4, a pretty good dose of vitamin D. 3, and then choline is essential in pregnancy, and most prenatals do not have adequate levels of choline, and it's only available in meat, eggs, and dairy, like egg yolks. So if people are vegan, for instance, they're getting like no choline, and it's so important for placental health and fetal brain development. So we see a lot of preeclampsia, right, in the older women population. So I think choline is really important to help prevent preeclampsia because it has a lot to do with placental health. So that's just like a basic, anyone pregnant or trying, we'd recommend. And then I think the most important things for, cellular health or antioxidants, right? So ubiquinol, bioavailable CoQ10 is ubiquinol. And sometimes acai berry or PQQ or other antioxidants we recommend. And then myo-inositol is really effective for PCOS. It's like insulin sensitizing. It's great for anxiety. It's really good for sleep. So a lot of people, and it's good for egg quality as well. And then NAC we use a lot because it's amazing for NAC is another antioxidant, but it's also really good for endometriosis. It's been shown to shrink endometriomas. It's also like good for blood sugar issues and PCOS. So
Mm.
those are like the main things we would
That's a
use.
lot. That's a lot of.
It's kind of a lot, right? And then
I feel like some women are like, oh my gosh, like more stuff to add. I mean,
I know.
I didn't even do any supplements. I'll be honest. I did a
Really?
prenatal. I did a prenatal. I heard about like Brazil nuts were good to eat. I heard about acai berries, and I just didn't go overboard on all that. And I really value
Right.
this input because it's very helpful.
I know some people are just like, it's hard. Like, we don't want to overload people, but I
yeah.
think diet is like the number one first thing you should do, of course, because that's free. And,
Yeah. What, any like
diet
special kind of diet tips for women like looking to say improve egg quality?
I mean, we recommend in general trying to do sort of like a sort of hypoallergenic, low inflammatory diet with like gluten-free, dairy-free. But if somebody's like just totally fine with gluten and they don't have any like autoimmune disease and they're not like diarrhea every day, or you know what I mean? If they're just completely fine with it, I'm like, don't worry about it. Or if they're underweight already, they don't want to lose more weight. But typically like gluten-free, dairy-free, I mean, Mediterranean diet has been shown to have like, I mean, it's good for everything, right? It's like, good for longevity. It's good for, I mean, fertility outcomes. And so, but just being on like mostly like a lot of whole foods, reducing your sugar, definitely reducing the caffeine because it's vasoconstricting.
When you say, so like you're talking during fertility treatments, really reducing the caffeine, right?
You want to get pregnant and also in pregnancy, I think it's great to like limit it to maybe 100 milligrams. If you
Okay.
can eliminate it, it's awesome, especially for the women that have the high Dopplers, like the uterine artery pulsatility. That is important. But I mean,
Green tea. Yeah, green tea was recommended to me to drink green
yeah,
tea.
because it has antioxidants. Yeah.
Mm-hmm.
And it's like way less caffeine, right? If people
Mm-hmm.
drink coffee, they might want to back it off. The coffee.
What about drinking through, if you're getting acupuncture, going through?
I think it's fine. I mean, I don't think alcohol is extremely toxic, and I think it's horrible for everything, to be honest.
Yeah.
And so I think like most REs, I would say like limit it to 4 drinks a week, alcoholic drinks, but it's extremely inflammatory and it's so bad for your sleep. I'm also like obsessed with sleep because it is the most important thing. Like, I think sleep and exercise are probably the most important things anyone can do for just like overall health, right?
Yeah. Back to basics, right?
Yeah,
Back
and
to basics.
alcohol destroys you. You can't get deep sleep. You can't get it's not possible to get good sleep with alcohol. And so bad for your mood, gives people anxiety, I mean, like the next day. So, I mean, I don't tell people you can't drink it all, but I think if you're going to be investing in a treatment like IVF, and there was an old study, I didn't like look it up or anything recently, but of like for both partners going through an IVF, like for 3 months to not drink was ideal.
Really? Okay.
Yeah, like the man and the woman. If it's a man, you know what I'm saying? If you're using the guy's sperm.
Yeah.
So, I mean, I think if people can really reduce their alcohol intake, it's great. I wouldn't drink 1 drop of alcohol in pregnancy based on just how it affects sleep. They did a study in England, and like women, I guess, were drinking some wine in the study, and like the babies got no REM sleep. Babies are like mostly in REM, and like that's really important for brain development. And so when you think about that, like it's not worth it. I just don't think alcohol's very good.
Yeah. Thank you. This is good information. Really, really good. Have there been many changes within the field of Chinese medicine, acupuncture lately? Like any big things that you want to share or highlight, or have things been kind of like the same for a while?
I mean, I think, well, the AFORM changed their name, but I think, there has definitely been, like when I started doing fertility stuff, Randine's book had just come out. And so it sort of like brought like the idea of Chinese medicine and acupuncture to the fertility, like the consumer, to the lay person, right? And that was great. And then, I think that a lot of fertility clinics in the past, I would say, I mean, when I started, like no one was like dying to talk, doctors weren't like inviting me over, but
Yeah.
now they do, or
Yeah.
they would
Yeah.
like come to my clinic and,
Mm-hmm.
they want us to send them patient. We have a
Yeah.
really good relationship with most of the RE clinics in town
Mhm.
because they know we know what we're doing and they trust
Yeah.
us to see their
Yeah.
patients. So that's a change since I started for sure that, you know, doctors think that we're, a
Yeah.
legit,
They're respecting you.
yeah.
I have a question about like, just so if someone says, well, I'm going to go to my free community acupuncture clinic to get free community acupuncture,
Yeah.
could that actually be more harmful than going to a specialist in the fertility space for
I mean, I think that's any acupuncture is relaxing and good.
Okay.
So I think if people can't afford, a specialist or whatever, I think it's fine to do that. It's not going to
Okay.
hurt them. I don't think it's going to hurt them.
Okay.
I mean,
Okay.
I
I just
honestly
don't
don't.
understand the cycle, like where people are at in their
I mean,
cycles
they
and
might not be as effective in like tailoring the
okay.
treatments to the cycle, but I don't think they're going to harm them necessarily.
Okay.
I think we're like somebody who's not well trained and clinically experienced, and doesn't know the Western medicine stuff could do harm is just this. I want to say a bad word, but like the shit they say.
It's
Like
okay.
honestly, like I've had people come and tell me crazy things, or they were like, "I've been bleeding for 3 months," and this acupuncturist was like, just like not telling her to get something checked. You know what I'm saying? Like it's just not okay. Or somebody once had an ectopic pregnancy and they were going to some acupuncturist and they were like, it's because you ate that salad,
Oh my
like that cold food. And I was like, that's just nonsense, or
God. Oh my God.
like, so you don't want to go to somebody that doesn't know like the Western science
Yeah.
also a little bit,
Okay.
Just-
Wow. Well, the work you're doing is so important. I'm grateful to know you and have been able to connect with you, lead some of your support groups, and
No,
just
we were so grateful that you were willing to do that. It's just great.
yeah.
People
Thanks
love
for
your
featuring
book.
my
Yeah,
book too.
people love. I just talked to somebody today about how much they loved your book. They were like, it's so many good tips and
Oh,
everything. Yeah.
thank you so much. Well, you're doing some great stuff here in Colorado. We're lucky to have you in Denver. And do you see people for consults like anywhere in the world, or do you
It's
mostly?
not so we have people who travel here a lot because they're
Mhm.
going to uh, you know
Top
get
clinics? We'll just
IVF. Yeah, they're going to
yeah.
like CCRM often from other places, and sometimes for to conception sometimes from like other parts of the country. And
Mhm.
people come from like Guatemala and like,
Really?
so yeah, we've had like people from South America,
Yeah.
and
Wow.
I did see somebody once from Saudi Arabia who came here. She
Wow.
came to see me, and then some like
Ah,
Cairo or something crazy. She got pregnant eventually.
oh,
Um,
wow.
but I don't do it. I can do telehealth. I don't right now do a lot of
Mhm.
it, but it was to be more like in a coaching aspect, because you can't do across state
Yeah.
lines like a practitioner. But mostly we see people in person here. Yeah.
Yeah. You're world renowned. That's amazing.
I don't know if that's true, but um
That's
yeah,
awesome.
like it's really fun to see people from other places and just because
Hmm.
they've often done a bunch of um treatments at other clinics and just to hear what other people are doing.
Yeah.
It's really like that's how I've learned the most is honestly, I've been lucky to be here where we have so many great fertility clinics because it's
Yeah.
like very cutting edge.
Hmm.
And I've learned about like the new develop, like when things are new, it comes here we tend to have it first. And so I've just learned from my patients. Honestly, I've learned like so much from my patients. It's like I've learned everything from them, to be
Yeah.
honest. And yeah, because they're experts. People are so expert. Like if a
Hmm.
woman is like, has endometriosis and she's going through infertility, like she knows like everything, a lot of them, right? A lot of the people I've seen,
Hmm.
they know everything and they know who the best doctors are. And so that's how I've learned so much.
Yeah. And what are some of the most common conditions you treat? Endometriosis,
I mean,
PCOS, like,
I think a lot of what's weird is now I feel like a lot of unexplained infertility that we're seeing. I think it's environmental from like phthalates and
uh-huh.
EAs and whatever else that is in our environment because I can tell you it's like profoundly different. I feel like than it was maybe even 5 years ago in terms of the age of women who have perfect labs, it's like unexplained. It's wild. And
I've
they're
heard
young.
Dr. Green would say it's unspecified.
Yeah. And it's like in
Yeah.
it. So I also wonder a lot of times if there's more to sperm than is, they haven't changed like semen analysis forever. Although there's like a new one called Path Fertility, which is a more advanced like methylation semen analysis, sperm analysis.
Yeah.
And I feel like there's something to that,
I just did a talk about DNA sperm fragmentation. So
Yeah, yeah.
stay on the lookout for that. But
Hey,
yeah, no.
yeah. I think there's more going on that side than has ever been like research. But I do feel like, we see a lot of people with PCOS, some endo, advanced maternal age, people that are older.
Diminished ovarian reserve.
Yeah, that, but it's just really interesting. I can just see a difference in terms of like the women who are young and have a lot of eggs and perfect labs, and then they're like, either and not getting pregnant, but sometimes just not getting that many normal embryos for their age. It's wild.
Yeah.
It's different. I think it's changed. I think there's something that like hit a critical mass or something. You know what I mean? Environmentally or epigenetic, maybe exposure to stuff.
Oh my God. It is kind of scary to think about. I don't know. Like, why is this happening more and more? But you think environmental
I do think
factors,
that.
different hormone
Sperm too.
disruptors.
Yes, and sperm and
Yeah, that's a whole nother
everything.
talk as well. There's just so much to cover on this, isn't there?
So much. There's so
Oh my
much.
gosh. Well, tell everybody like you're at Acupuncture Denver, you're here, your website. Share your website.
It's acudenver.com. So acudenver.com. And we do have that free. It's a peer led support group right now, free once a month. So anyone can come to that. And I'm thinking of like developing a little more like online kind of community stuff. If I get, I don't have a lot of time.
Okay.
Like I have the goal and like the aspiration, but if it'll happen, I'm not really sure.
You have like 3 acupuncturists at your clinic, right? 3 of you?
There's me and then Mary Reasons and Molly Shaw, and they are all AFORM certified. They are also very experienced. They've all been there Mary's been there for like, I don't even know, since 2008. I've been there since 2013. So they're great. And we also have massage therapy, and my husband is one of the massage therapists.
I love it. It's a family affair.
Yeah, he just did he's certified in prenatal and perinatal massage now. So
wow. Hi, Greg.
Yeah, he might end up doing even like mine abdominal, which seems weird, right? But I don't know. There's also another treatment like that called, I forgot, this woman in Chicago.
There's Arvigo. There's
that's
my end, but then
there's a newer, it's just similar like uterine massage that this woman in Chicago's doing trainings in.
Wow.
There's Mayan people he could train with here. But yeah, we have that. Yeah, because it's nice for people to be able to get. We also have an infrared sauna, which I don't ever. People don't even know we have it, I think, often.
So tell us about that real quick. What do you use that for?
My goal or my sort of reason, I just love saunas and I like to use it. But I thought it would be really ideal for people post retrieval, like to kind of clear, it helps detox, hormones and all that stuff.
Okay.
They're all bloated and, just trying to help with like clearing out just all the excess and things like that.
You encourage people to take a break. I think I could ask you more and more questions.
Yeah, like take a break after retrieval, or
they
just
had like a transfer that was unsuccessful, and then wanting to kind of get their body, just give it a break or take a rest. Do you encourage some of that?
I think so. Yeah. If they had especially if they have embryos frozen, they're not going anywhere. Right. I mean, I think in general, it's great emotionally to take a break, just to stop thinking about it, just like when I was going through my own journey, and I remember like I was having this weird spotting, of course, like some weird thing I'd never had. And then when I decided to adopt, I just remember being like, I don't care what comes out of my vagina. Like, you know what I mean? Like I was having some weird thing and I was like, I don't care. I don't have to think about it anymore. Like I think people get so, the phenomena, for instance, where when people are trying naturally or any time, but it's been on their mind, it's obsessive, and they feel you feel like every little twinge in your uterus, your
Mhm.
ovary, people
Yeah.
become so hypersensitive.
Yeah.
And,
Oh, yeah.
I just think that emotional break, it's
For
like, don't
sure.
think about it. Don't maybe worry about taking all of, try to take some
Yeah.
supplements, but go like exercise. Cause a lot of people reduce their exercise, I think, too much. And then they get
Mhm.
depressed and gain weight. And I think it's great to take a break
Yeah.
and feel like they can get their life back, right? Like feel like
Yeah.
themselves again, like they're not hijacked by
No, I
hormones.
think a break is essential. Um, and then exercise. What kind of exercise do you suggest during treatments? Anything for during acupuncture?
Of course, during IVF, you have to be careful, right, about ovarian torsion. You don't want to be like jumping around with large ovaries that could torse, right? But I
Mm-hmm.
think in general, women should be doing more exercise than they do. And
Mm-hmm.
there was a Harvard nurses study too that showed that like over many, many years, like women who were fit and exercised regularly had better fertility. And I mean, I'm really into exercise personally, and
Yeah.
women all need to be strength training for like our bones and
Yeah.
muscle.
Yeah.
You lose like 10% of like your muscle per decade if you're not really actively working on it.
Yeah.
So I feel like just you can do weight training even when you're going through some of the treatments because you're not
Mm-hmm.
necessarily jumping around.
Or the twisting. I know there's times in your cycle
Yeah,
to be doing some twisting and
right.
bending.
And like doing like really closed twists and yoga and stuff like that.
Yeah. Yeah. Oh my gosh. This has been amazing. Thank you so much for just
I
all of
loved
your
it.
knowledge.
It was so fun. I could
I'm
talk to
learning.
you all day.
I
I
know.
talk too much as well, as you might know. No,
What's that?
I talk too much. Yeah. I talk.
No, no, you don't. I'm so grateful for your time and just, I mean, there's a lot, there's more questions I'm sure that'll come up. I mean, we could do another chat at some point, but I appreciate what you do, and people can reach you at acudenver.com
Yeah.
and book a session. And yeah, I appreciate you so much. Thank you.
Thank you, Lisa. I appreciate you too. And I'm so glad you're doing what you're doing. It's really valuable and awesome.
Thank you. Thank you.
Important too. And I
Look
know
forward to
I
seeing you
love it.
again.
All right. We'll do it again sometime.
All
Okay.
right. Thank you,
All right.
Jane.
Thanks. Take
Bye.
care. Bye.